All right, we shall begin. Unfortunately, I have it on my computer at uh, on my office computer, but I didn't transfer it to here. That herpes virus thing, which is what I'm going to work on today with these. And then basically, this is all about viruses today. We're doing a bunch, kind of where we left it, and this is kind of where we were here, and we had covered all of these with, and I always do it this way with the except of these DNA viruses and the herpetic viruses, and that's a term that you should get used to. Is when they utilize the term for herpes. Herpetic and herpes it's just an adjective that you use to describe it. And I was reading about a case. It was in one of the newspapers I look at about or one of the online news services about. It was actually a form of herpetic encephalitis, which is shocking. Okay, and we're going to see that when we begin to look at a little bit into sexually transmitted or genital urinary diseases. What happens with certain kinds of first case herpes during, if they're inadvertently, during the birth process or if there hasn't been adequate prenatal care. And it's called herpes encephalitis, and it's usually fatal in a newborn child. And they were talking about a case of this. And so I want to doing this to contextually underscore how important this stuff is. So you hear about meningitis all the time. About 4% of all viral meningitis comes from herpes infections. And most of us, you would dare say nearly all of us, have been exposed to at least herpes type 1. We just have. If you ever had a cold sore, you had herpes type 1. Guaranteed. And so what happens is now usually herpetic viruses like that come out at various times during stress, during trauma. Uh, Sometimes it can be physical stress, psychological stress, accidents, loss of a loved one. Pick a scenario. And we'll talk about that a little bit today, like vis-a-vis shingles and things like that, when they sort of rear their ugly head. What happened to my daughter back in, I'm going to tell you, maybe at least 10 years ago, is she ended up with herpes meningitis because it was satisfactorily treated with the medication we use for herpes, which are called acyclovirs, which we'll learn about. And then it's almost diagnostic for it because those are antivirals that are very, very, as you hear about Valtrex, effectively, this is the intravenous, and both she took the oral form of that equivalent. And I mean, put her in the hospital for a while, with full blown meningitis syndrome. It's not as dangerous as bacterial meningitis, but it could proceed to encephalitis, which implies brain damage on top of it. And the doctors, all this effectively, he described it to her in sort of an innocent fashion, rather than coming out and being on your lip. A cold sore went in, rather than went into the brain as opposed to going out. Normally, the pattern of inflammation goes out toward the skin because it's attached to a sensory nerve coming from typically the skin or mucosal membrane. So it generally starts right about here, for most of the cases on the soft membranes of the lip. Go figure. So that's just trying to underscore this whole realm of viruses that's so interesting. And normally, like I said, I have this written down. I got all this nonsense here. But effectively, we call them all HHV for human herpes virus. And then you do them by number. HHV1, 2, 3, 4, 5, interestingly enough, 6 and 8. And they're all different. They don't, even though they're all herpetic viruses, they don't necessarily spread the same way as far as we know. And to be fair, most of them are transmitted by some degree of contact from fluids or intimate contact. There's no question about that. But not all of them. I mean, maybe the one that's the most common of all of these, maybe we say this today, is number 3, and that's spread respiratorily. That's what makes chickenpox. So just moving on with all this. So HHV1 is also known as HSV1 or herpes simplex, which is its original name, simple virus. So we call that nowadays, because it's most commonly found here, and it's not quite as severe, oral herpes. HSV2, again, herpes simplex 2. And I'll send you the handout I have. It's easier. Genital herpes, because we see it most frequently here, and it is more severe. Again, both of these certainly would classify under the STD. They are. And these days, understand that it doesn't preclude one from the other. You can get genital herpes orally and oral herpes genitally. It's just the severity of the onset of the genital herpes and persistence of it is probably a bit greater than this one is known as VZV. Stands for varicella, which is chickenpox, which we're going to visit again. Zoster, which we're going to visit again, which is shingles virus. And that respiratory. And so these are all associated with latency. So they hide, as I said before, in the dorsal root ganglia or central root ganglia commonly, and it can come out at any time. 1/3 of us are statistically going to have shingles. Well, I never had the chickenpox. Well, you guys didn't have chickenpox because you were probably all immunized. Immunization came out in 1991. My kids who were born in 83, 84, 86 all had the chickenpox within 2 weeks of each other, might I add, in order of their age, interestingly. And they're not biological siblings at all. Pre-adopted children, all different genetically speaking, and all had different presentations, which is wild about the disease. My oldest had the typical disease. We were ecstatic. Okay, got it. Covered in red spots all over the place, 104 fever, slowed him down a little bit, went to stay with, because we had 2 other little ones at the same time, went to stay with grandma and grandpa, and it was great. And we knew it, because his parents had a good case of a lot of. Did I tell you about measles and chickenpox parties? I did tell you about the circus, remember that anecdote? Yeah. Calabees! They put us in jail. My middle one didn't even slow him down. 102 fever, hardly a spot. He's still flying around. We were very disappointed. My daughter, 106 fever, nearly lifelike for her. Same disease, different presentation. Give you an idea. So what happens for most of us, so if you were immunized, or you were like me and had it, or like my kids and had it, or if you were just exposed to it, as nearly everybody was, you now harbor that virus, whether it presented or not. And so effectively it's latent, and shingles can occur in the face, and most commonly in the torso, and they follow the course of the So you see a series, and they're not like the typical pustule pox. A pox means a pustule. So we see in chickenpox, it shows up very distinctively, and it breaks down, they form little scabs, and that's what and they're mostly itchy. Shingles are just angry, they're extraordinary. But one time we didn't have any kind of treatment for it. Now we have that whole category of Valtrex or steroids, which are very useful in order to treat them. Before, my biggest concern when I had a patient I treated with shingles, getting off pain. Because that's the only, we had steroids. There isn't a whole lot of treatment options. That's so common. So far, all of these are latent. This one is respiratory. Now we get to one that's definitely sexually transmitted. You've all heard about it. It's called EBV, Epstein-Barr. The name of this very, very famous virus. It is a virus that can lead to cancers. Not frequently, but it can. Associated with, famously in Africa, with something called Burkitt's lymphoma that we'll see later. And nasopharyngeal carcinomas, which occur but rarely, but it is associated. So it's one of those interesting viruses associated with cancer. So Epstein-Barr virus, and what the disease it causes? Mononucleosis. Very famous. So we think we always call it the kissing disease. Look, for first-year students in college, routinely we have somebody with mono. It's interesting because it looks a lot like a strep throat. When you look inside the throat, you have swollen lymph glands that are injected or red with pustules. And the differential is strep throat, maybe something really bad, or mono, depending on the test. So it's fairly common in that regard. Plays a large role with overcrowding. In the old days with college, it was the first time people were experiencing more degrees of intimacy, let's say, lineage. I'm just guessing with regard to that. But again, the possibility of the association with cancer is noteworthy. One, I'm not sure whether it's respiratory or whether it's contact or perhaps even both. Okay, it's called CMV. Stands for cytomegalo. Galo means really big virus. And that is also a kind of mononucleosis in the sense that it impacts your immune, and both of these impact your immune system. That's the difficulty. It affects mononuclear forms. Did you guys get the blood unit yet, the white blood cell unit? Okay. So mononuclear forms are lymphocytes and monocytes. And they play such a they're tremendously important, and we see them elevated in viral infections. But when it affects lymphocytes, and you're talking about B cells and T cells, they're playing a big time role in your being. So that's a noteworthy thing. We typically see this in infants or in people who are, it's a bad disease to have, or people who are in, what should I say, compromised to some extent. Their immune systems aren't so strong to start with. Interestingly enough, another aside, it's happened to me at some juncture. Both of these are diseases that if you had as a kid, they're latent. And the good thing about being young is you can tolerate fever, whether it's chickenpox, whether it's mono. Most college students don't do that. My first wife had this. 20 years later, she had adult onset recurrent mononucleosis. We had the same, that was 1989. Oh, yeah. We had 3 kids, between 6, 5, and 3. She couldn't get out of bed for 6 weeks. Most she could do was get out of bed. I had to work and hire somebody to do the kids full time and came home. Took over that. Which is when I was young, man. Very old. My oldest was 40. Okay. So the differential diagnosis, what they were deciding was these two, was between whether it's Epstein-Barr or CMV, but they knew she had mono at that point in time. This one's kind of interesting. We just call it HHV6. And it has a very interesting disease that we'll learn about in skin disease that most of you probably have, called roseola. It's a common disease in infants, and it looks a lot like the measles. When you get to measles famously were called rubeola because they had ruby red spots. This one had spots that were not quite as distinctively red, hence it got its name. And it's one of those, remember I told you about the disease we used to number, it was in the number again. For roseola. Very high fever that breaks, and then a rash typically shows up on the abdomen and kidney spectrum. And of course, all my kids had it. What's interesting to that is we see a statistical association with antibody titers with this, not that it's a cause with MS. So that's one of the areas of research. And MS, multiple sclerosis, is certainly an autoimmune disease. Whether there's a viral component that's associated with this, I don't know. Again, most of us have been exposed to this virus, so it's statistically they do things called correlation coefficients. How many people had test positive for roseola and have MS? It's very common. Whether or not it's cause and effect, that's a whole different thing. And lastly, and perhaps very, very famously, is HHV8. Roseola, I personally think it's probably respiratory. I'm not sure. Question mark. And this one doesn't even, we just call it HAV8, and the disease it causes is something that really became noteworthy in the HIV era early on, called Kaposi sarcoma. So we're pretty sure it is blood-body fluid, sexually transmitted, and definitely associated because it's a kind of skin cancer. Not really skin. Sarcomas are connective tissue cancer. So they look like red blotches on the skin. So if you go back to your skin unit, you probably talked a little bit about something called a melanoma. It's a pigment tumor. And the diagnosis you do not want to have. Okay. Very bad diagnosis. Kaposi's looks like it because it's like red, pigmented, raised, ugly looking things on the skin. But the reality, when they biopsy it, it's coming from the connective tissue around blood vessels, and the pigmentation comes from the blood vessels. It's not, now it's what's called an AIDS defining diagnosis. If you have HIV positive and you're diagnosed with Kaposi's sarcoma, you now have AIDS because you're only when your immune system collapses. It didn't come from HIV. Kaposi wrote about this in the late 1800s. To give you an idea, so it was around the better part of 100 years before we ever heard the word HIV. So understand, that's very, very interesting. Where I saw, it was such an unusual thing, it was something you read about in textbooks. And I think maybe I told you, but I'll certainly tell you again with the HIV thing that was there. I spent 6 years in Philadelphia as a student and a resident physician. And in an area, and Philadelphia, statistically, after San Francisco, had the largest gay population, gay male population, statistically. So we were at the forefront before they even had the word AIDS in the lexicon, before they knew about HIV in the lexicon. I saw 2 cases inside of 6 months, about a mile apart, because one when I was a student, one when I was a resident of Kaposi's sarcoma. Get that, in indigent gay men. We had a very, very large, where I worked in the inner city, we had a very large homeless indigent population. Those are all herpes viruses. So all of them, to some extent, stay with you. There's a lot of information, and we'll look at these. The Kaposi's is an interesting nugget because it's just a sign that your immune system has collapsed, typically. And so probably those, when Kaposi first saw it way back before 1900, it was probably in people who had immunological diseases, and they just didn't understand what they were. Somebody who was very, very ill and demonstrated this particular interesting looking disease entity, and then they subsequently died, and certainly it was a cancer. So that's all the stuff. So the watchword here for most of these we have, as you can see, Epstein, you should remember Epstein-Barr and the HHV8 are both associated with cancers. By and large, they're all in the latency aspect of things. They're relatively common, and interestingly, they are enveloped viruses. So they're not that easily passed on surfaces and things. Routine degrees of disinfection should probably deal with them, relatively speaking, effectively. So I think that's the first little aspect. Okay, so that's all of the RNA viruses. And I use this table because they didn't have much of a table in the Cowan PowerPoint comparatively. And again, I think you need to know a bit about these, and we're going to revisit a lot of these that are there. So as we move on, we get to the other virus, RNA viruses. And if the commonality was latency, okay, the commonality in DNA viruses, the commonality in RNA viruses is mutation. Remember what viruses do. They occupy our cells. They have to replicate their RNA. RNA replication is not nearly as governed a process as DNA replication. Whether you're working from RNA and making DNA, or you're working from RNA and making more RNA, you encounter mutations. It's just not because this is happening, let's say, inside of our cells for our context, or other animal cells or eukaryotic cells that have mechanisms to deal with DNA errors, but very little with RNA errors. So they mutate. And ladies and gentlemen, all you have to do is think about influenza and think about COVID and think about the common cold. Why there's so many of these things? Because they mutate all the time. And thankfully, I'm starting to read more articles about COVID where they've stopped, every time there's a new variant, having to make another vaccine. I mean, it's going to be like influenza. Just by and large, the severity gets less in a typical healthy individual, and the need for immunizations, which are not without risk, decreases as well. So I think we're going to see, and the article I was reading was in one of the New York newspapers because some of the universities, starting with one up in Rochester, RIT, Rochester Institute of Technology, no longer have the vaccine mandates for incoming students. If you want to get one, get one. But mandating, I always have issues with regard to those things. So there have been some vaccine campaigns, and we're going to talk about one ever so quickly that you'll be very, very interested in. Okay, we will start here. First, the first three on the list are all major players. They're all naked viruses, and they're all, relatively speaking, pains in the neck. And I have anecdotes. And the first one is a personal anecdote. The moral of the story: don't take your 10-month-old, recently adopted after 5 years of trying, child to San Antonio for New Year's to meet with your best friends at the time. You just don't do that. Why? Right here. Rotavirus or rotavirus, which is an infantile diarrhea viruses, and we are seeing some immunizations for that. It is endemic. You heard a lot during COVID about herd immunity, when people have been exposed to it and when it had antibodies, and the fact that when a lot of people have been either exposed or developed antibodies or passed on antibodies or the genetic makeup to make certain antibodies, with that many healthy people, it's hard to spread the disease. To rotavirus in the areas that border the Rio Grande, like southern Texas, for instance, a lot of the population inherently has immunity to rotavirus. It is everywhere. We got there for New Year's, and we were going to spend a week to 10 days with our friends, staying in San Antonio, which is a great city, by the way. Right out of the Riverwalk. If you've ever been to San Antonio, the Riverwalk is immense. It's tremendous fun. And we had a wonderful dinner outside. We'd go to the Alamo, the usual stuff that you do in San Antonio. And if you're in San Antonio, the name's on the tip of my tongue. I'll give you the name of it. It was on Diners, Drive-Ins, and Dives. It's absolutely the best breakfast place ever, just outside of San Antonio. I promise I'll get it for you. We were there twice. All that aside, we had gone down to a New Year's party at the hotel we were staying at, Texas Two-Step, all that. They do New Year's really well down there. We had done one at Billy Bob's the year before, where they had actual bull riding, not mechanical bulls, live bulls. There's an old movie with John Travolta called Urban Cowboy that was filmed there. Remember that movie? It was great. Deborah Winger, okay, with bull riding. Long story short, this is a long story long. We got upstairs, and their two kids, who were like 12 and 13, were watching our little one. We're babysitting while we partied. They're having a good time. Anyway, he's throwing up diarrhea everywhere. We spent the next week in Santa Rosa Children's Medical Center. He had to undergo a spinal tap because that's part of the way that the diagnostic criteria, you have to rule out bacterial meningitis. And it was determined that he had rotavirus, and all they could do was really supportive therapy. He's fine. The one who's 40, commanding a ship. So it had a happy ending. That's how severe that was. We spent our whole vacation at that hotel. And I'm doing not overnights. My wife's doing during the day. I'm sleeping during the day with a 10-month-old in the room at the Children's Medical Center. Woo! In the old days, it was called respiratory enteric orphan. That's where the Rio comes from, not Rio de Janeiro, which is with an I anyway. But now we call it rotavirus. And again, it's a naked virus, and it can be prevalent around here. It is something to watch for, and particularly the moral of the story, if you travel anywhere, particularly with small children, be very aware, because their immune systems are not well developed, certainly at age 10 months. So be very, very cautious about those types of things. So this is interestingly, a double-stranded RNA, which is unusual to start with. There's not a lot of treatment other than supportive care. And yes, we're starting to see an increase of it as it moves up the coastal areas, particularly in the Atlantic coast. That's the first anecdote. The second one is not nearly as interesting, but very significant. This is the most common kinds of viruses that you and I face. These are called picoRNA. Pico means extremely tiny. So you can call them pico or picornaviruses, whatever you want to call them. And there are two basic categories. There are rhinoviruses. Rhino means nose. There's hundreds of mutations of these, which we call types. And what are they known for? You guessed it, the common cold. So if you wonder why some colds, you have sinuses, sometimes you have headaches, sometimes you have sore throats, sometimes you feel sick to your stomach. There's all sorts of variations. Your body responds to viruses basically immunologically. Most of the damage that's done by viruses we call indirect mechanisms. You'll learn about those. Bacteria make toxins, so they damage stuff by secretions. Viruses, it's your immune, it's COVID. It's a reaction of your immune system. Not a whole lot different. So one category, and these are respiratorily spread, as everybody would know. Now, same category, because it's based on their shape or their architecture, whether they're RNA. These are naked, envelope or not, the three criteria. The other group of these are fecal to oral and very famous. We call them entero or enteric viruses. So they're passed gastrointestinally from something we eat. And if somebody has diarrhea and it gets on their hands, you got the idea with regard to it. And and there's a number of subgroups in there that are very severe. Kawasaki is a virus that's in this category, but maybe the two most famous, hepatitis A and polio. Hepatitis A, which we now have an immunization for, and I think I told you early in the class, the most famous outbreak of hepatitis A right here, Chi Chi's, the restaurant up in Beaver Falls. That chain that was already in bankruptcy. It was a very popular chain, and they'd had some problems, I think more financially than health-wise, and they had a major outbreak around here that infected 1,000 people about 20 years ago. Needless to say, that killed the chain. From a restaurant perspective, they still make salsa and things like that. And what had happened, it came from green onions or scallions that were being used raw, and someone got sick. And this is one of those interesting, hepatitis A is one of those viruses that's particularly hard to get rid of on surfaces. And you really don't, you're contagious before you really are sick. Oh, my stomach feels upset, I gotta go to the bathroom, versus, oh my God, diarrhea. And this person was probably in the stages, obviously wasn't careful with regard to hand care. I'm sure that's the problem. And anytime this was used as a garnish, which it frequently is in Mexican, Hispanic, whatever is the politically correct term, cuisine, Tex-Mex, green onions, bam. You got to throw those bad boys on, and they're wonderful. They're wonderful for Thai cuisine, lemongrass, fish sauce, green onions. That's the base for most of the cuisine that's there. Just saying. Okay, hepatitis A. In those days, you only could use gamma globulin. If you did the blood unit, you learned about globulins. Gamma globulins and the immunoglobulins are in that category. They used to give a big dose of gamma globulin. 4 people died, and they weren't all very old or very young in that particular outbreak in and around the area. And imagine when you're off a major highway like the Turnpike, a lot of people would stop there, hop back on the Turnpike. So it spread pretty well, not just being confined here to Western PA. That was the hepatitis A. Now there's an immunization for it. Whether it's part of the regular immunizations, you in nursing will find that out. I don't know. I haven't bothered to keep up. Which brings us to polio, which you are all immunized for. Okay. And why it's so relevant to right here, guess where the research was done for the original polio vaccine? That's right, University of Pittsburgh. When I started here in 2008, 15 years ago, one of our professors, who was a professor emeritus, meaning he was semi-retired and was on the original team because he graduated from medical school at Pitt with Dr. Salk, who did the original vaccine. He's still alive. Okay, he's probably in his early 90s. Okay. So, he was here teaching micro many, many years ago. Talk about an authority figure. So one of those people, that if you Google their name, you learn a lot about them. So polio, the interesting thing about this is it's fecal to oral. The original vaccine was done by injection. I can remember being a screaming little kid and getting a shot when I was 5 years old. So that became available around 1955, 1956. I was born in 1951. In 1964, 65, that area, they subsequently did research that showed that this is not completely, and polio is a horrible disease. Even though it was passed fecal to oral, it entered through the GI tract and targeted nerves going to muscles and paralyzed them. It was called infantile paralysis. Overnight, a child would get up and couldn't move, typically from their legs, was to start. And it would ascend, and they couldn't breathe. They had to put them in a thing called an iron lung. If they did recover, the muscles, when they start to get power again, the weaker extensor muscles, they had flexion contractures. My first wife had an aunt who didn't succumb to it, but ended up with double amputation when she was a little girl, who became one of the early advocates for magic carpet and the handicap transport system. She was really the founder of those systems that was now called Access in Pittsburgh. So it's a very, very interesting story that she'd go everywhere. She was a patron of the arts and everything like that. A brilliant one. Nevertheless, so polio, very significant. I treated lots and lots of patients who were older than I am who had polio. In around 1964, they had done more research and found it was fecal to oral. It only made sense that the immunization be administered that way, which is absolutely correct. They immunized the entire country. They put on like at monthly intervals times 3. We went to the high school, you go to your church, go to the community building. All the doctors and nurses came together. They had all the census rolls, and everybody, they gave you a sugar cube that they had put a drop of this red liquid on, and we took it. And if I didn't tell you, just to show you how the world has changed, when I got, I think, my second dose, I was staying overnight with a buddy of mine who's now an attorney out in California. His dad called my dad. Hey, we're going over to high school to get that second sugar cube. We'll take Lou. Okay, well, I'll be over there a little early. I'll tell him you're bringing him. Can you imagine now today with a 15 or a 14-year-old taking somebody else's kid to get an immunization? Whatever, the people would go nuts. They'd go wild. Oh my God, liability. Different world, everybody. Just say it. That's the saga of polio. Very relevant because it was done here. Been very, very effective. The concern has always been that it starts early on. So that, I think, is still the earliest of the immunizations, maybe starting around 2 months. And it's there. And and again, if you remember me talking a little bit about preservatives, that's one of the concerns. Not with the polio vaccine per se, but a lot of the amount of preservatives in a developing nervous system in vaccines. And that has been very impactful. So I don't know statistically if they have looked at that or not. But so that's where these are all naked viruses. They're everywhere. If we didn't have that vaccination, polio would be there. Arguably, one of the 2 or 3 most famous presidents, president during World War II, Franklin Delano Roosevelt, who was a 4-term president before they had the amendment to restrict that, had polio. He developed, whenever you saw him, the very famous speech, the Day of Infamy speech in front of Congress, he had such strong upper body that he developed, because he was in a wheelchair other than that, but he didn't want anybody to see him. So they got him arranged and stood so that when the cameras went on, that everybody could film that. And those days, it wasn't live TV or anything, it was before that. And you could see that. And that's why he had fireside chats, because he would be sitting by the fireside, so it looked a little bit different. He got that from contaminated water and that's where it comes from. Contaminated, typically animal contamination of water. And that's sort of the lineage when we get to HIV. Remember that, because we'll be coming back to it. Okay? So, moving right along. Calliciviridae. A calyx, if you remember, like the Geico calyx, is a shell. though they don't demonstrate it, and I'm sure they would have to have other illustrations that would be more telling. This is a very famous virus we used to call Norwalk. Now we call it Noro. It is fecal to oral. It is naked, and it is a bear. And if you're going into nursing, okay, you're going to encounter it. It affects schools. It affects colleges. It affects floors of nursing homes. They close them because it spreads like wildfire. You know, hospitals and places like that, it easily spread. It got into the food in Ringgold School District about 18 to 20 years ago, and closed that district down because it's a small school district. All the food was made centrally and sent to the other schools for school lunches. And somebody was sick, didn't know they have it. If you see a cruise ship turn around and come back to port, dollars to donuts. It's another one of these that's very, very hard to get rid of on surfaces, and people don't know they're sick until they really are sick. And and there's nothing more contained than a cruise ship. No more contained environment than that. So that can be a real bear anyway. Cruise ships have gotten pretty elaborate of late. Moving on. So those are the non-enveloped or naked variety of the RNA viruses. Where we see element, to me, polio, rhinoviruses and enteroviruses have a lot of genetic variation. And so you do get this variation in the way they present. The hepatitis A, and understand we do hepatitis interestingly by letters. There's A, B, C, D, E, and F. We're only going to talk about A, B, and C. It doesn't minimize those. They're all in different categories, and they have certain differences. A, even though it's probably the mildest, and they used to call it infectious hepatitis. We'll get to B, which they called serum hepatitis because people would get that from transfusions. And now we screen better for that. And C would be the same way, even though they're in different categories, and we will get there with all of those. Which brings us to here. The calyx is the shell, and that's what the capsid had, what appeared to be a shell, even though it doesn't demonstrate it here, from norovirus. So we move on. Now we get to all of the rest, pretty much are enveloped viruses. So they're easier to deal with on surfaces. And they call this one togaviridae. A toga would be a cloak, so there was a distinctive envelope where it got its name. The most noteworthy of these, certainly by its impact over time, is rubella. Rubella is the R of MMR fame, measles, mumps, and rubella. That immunization came out, I'm going to tell you, I think that was in the mid 80s where we started to see the advent of that. Because my kids, I think, got that, but got this because they didn't have the chicken pox. None of them had. Rubella was called the German measles or the 3-day measles. It is a comparatively mild viral infection. Viruses is characterized as or categorized as a skin virus because it has fever and rash are very, very common. If you see fever and rash, start thinking about viruses. Well, other than that, the big problem with rubella impact on the unborn child. It's tremendously contagious. It's a very mild viral presentation. It is spread respiratorily. So you cough or sneeze in a confined space, you can easily pass it to somebody else. Easily. If that person passes it, or if that person is pregnant, particularly in the first trimester, big problems. I don't know if you have an appreciation for that. As I look in the classes I teach now, I don't see a lot of people with either hearing impairment, and when you have hearing impairment, you have speech impairment, because we learn to speak based on what we hear. Anybody of my age, every class had people in speech therapy, kids were in hearing aids. That's because we were before this, when we got this disease, and the disease was so prevalent. Every so often, you see what's called a rubella bulge, whether there's some problem with the vaccine or a particularly large unvaccinated population. It is, other than that, the disease that affects you is relatively innocent. The most noteworthy thing, I can still feel them here. They're called preauricular nodes on the back of my head. They're here, very, very sore. 102 fever, right before the junior prom, because it's classic. All those types of things. Just say it. Okay, so rubella enveloped virus, you can get rid of it on surfaces. Chikungunya is something that's vector borne from mosquitoes. We've seen some outbreaks in people in the islands. We think it came from Africa with either produce or shipping that unloaded in and around the Caribbean area, and the mosquitoes come out of the ship, and then the next thing you know, people are. So if you're doing an island and you're staying rustically, that's why you need mosquito netting for a variety of reasons. If you're going to do that, when I was in, we vacationed with my first wife back in Aruba, but we were in a hotel, so it really wasn't. It's not like we were staying rustically on the beach. That kind of stuff. So we move on. This is a great category. I'm looking at my time to make sure I can get it all in. We'll probably stop here, and we'll start with coronaviruses. Flava. Flavus implies yellow. Okay, so the poster child for this originally typically involved yellow discoloration of the skin. Most of the time that was associated with a condition which you should be aware of called jaundice. Jaundice impacts the liver directly or indirectly, limits the liver's ability to adequately process and or excrete bilirubin, which is the breakdown product of hemoglobin. We can recycle the globins, we can recycle the iron, the heme nugget that makes up hemoglobin, you can't. All you can do is make it more passable, and it's what creates the color of our urine and feces. Okay, which if you didn't get that yet, you'll learn about that. So all of these somehow impacted that, and they began to see this. And the most famous of these, yellow fever. Yellow fever was something that was seen, had been around for a while. It's a vector borne, it's mosquito borne. And when they were digging the Panama Canal at the turn of the last century, they noticed that. And the native population in Panama who had been exposed to this knew then that quinine alkaloids, and that's why the quinine thing got both good and bad publicity during COVID, that quinine alkaloids had an anti-inflammatory effect. And that was one of the treatments. So we use quinine-based products for a lot of things, not the least of which is malaria, which we'll get to, which is a disease in a different category, because it's not a virus, it's a protozoan. So we'll get there as time moves on. So you had yellow fever, dengue, another one that's very, very similar to it. That are they still doing that nursing thing down in Nicaragua? You guys in nursing? Pardon me? Yeah, they're doing it in Ecuador now. When they were doing it in Nicaragua, dengue was a concern. So Dr. Ross ran that forever. It probably still does. My neighbor. And so that was the concern, because we had talked about that with regard to travel and considerations during one of the conferences we were at. Hepatitis C. The kind of hepatitis we worry about, and that's surely the most prevalent now. Remember, we have a hepatitis B immunization now that's made genetically. But hepatitis C is the one that worries you. If someone has, and we will learn about it in this chapter, what's called chronic or persistent is really a better word, hepatitis C, you are at significant risk if you contact them. That means that in any of their secretions, they are producing hepatitis C particles. So if you get a blood splatter from one of them, the odds are about 1 in 500 for somebody who's HIV positive that you would contract HIV. They're a lot higher. So if you have someone that you're treating with active or persistent hepatitis C, be extraordinarily careful. It's not that we don't treat people, it's that we exercise the appropriate degree of care. That's why the good Lord made personal protective equipment. Thank you. So understand that. I stuck my hands inside people without gloves. We didn't wear gloves. We all did that. Somebody came in bleeding, put your hand on it. It wasn't like in the movies. It's back in 1977. Okay, I had a white coat that didn't protect anything. So if you don't have any cuts or openings in your hand, your skin's the best barrier for infectious disease. So understand that you have to be aware. That's why it's important to be familiar with the patients from nursing when you do report. That's what you learn about those things. So that's really an important aspect of that, to see what somebody's status is. Has there been a change? Are there any restrictions, et cetera, et cetera? So hepatitis C, we do not have an immunization for. It is the single greatest cause of liver transplants. It's the single greatest cause of death from liver disease. Okay, of an infectious origin. Underlying alcohol cirrhotic disease would probably take over as the major underlying cause for all of these things. And hepatitis C can happen to anybody. Are you ready for one last anecdote? Sure you are. I'll do Zika. Zika was when we went into the rainforest during Brazil during the World Cup and during the Olympics, and they had another disease that was producing in some infants microcephaly, and they actually had an outbreak because it was carried. How it got either on people or how the mosquitoes got there, got infected in Miami, I I don't know, but they did have a little cluster outbreak. Hepatitis C, first wife. So she probably got this back in 1981 when she had a blood transfusion. That was before they screened the blood in 87. So she had a condition where she had a blood splatter at work. They sent her to occupational health. I get a phone call. It's 2004. Tears, screaming, crying. I just tested positive for hepatitis C. I'm going to die. She had been exposed to it. It finally showed itself. She thankfully never required treatment. It was just a positive test of antibodies at that time. However, as her health has been challenged, she's a little older than I am, and now uh, basically they told her and told my kids. They said if she gets really sick again, we have to be very, very watchful. That hepatitis C is part of it, could resurface. Be careful. That's the bottom line. Goodbye. Talk to you soon. Oh, well, I'll send you the stuff about the test. I'd like to get it in before the end of the term. Don't look at me like that. You weren't doing anything next week at the end of the week, were you? You weren't busy.